This is Moment with Dr. Cole. So, what do we have today? Osteoarthritis. That sounds like a big word. Osteoarthritis. I'm sure a lot of people must have heard the word. Osteoarthritis is not out of this world. No. It's just chronic disease that affects the joints. And any joint can be affected. The hip, the knee, the ankle, even the fingers. These joints that I just mentioned can be affected. So, like I said, it's a chronic disease of generally. And then, so the problem about it, I'm not going to bore you about the medical part, the parts of the osteoarthritis. I'm just going to tell you what to do, or what are the things that can make somebody to be prone to having osteoarthritis. So let me just tell you what the osteoarthritis is just all about. It's just there's some cartilage around her joints. So it's the erosion. That erosion, it's way off the layers, the surface layer of the normal soil. You understand? That's just, so it's the erosion. Those cartilage gets chopped up. So in the process, so the cartilage are the one that serve as a bridge, preventing the two joints from rubbing on each other. So risk factors, because a lot of people ask that why am I having pain in my knee, all those kind of things. So this is why I'm here today, to educate you. So unfortunately, females are more likely to have osteoarthritis than male. You'll be saying, why female? Why female? Why female? Yeah, female. They are the more that are more prone to it. Not that male doesn't have it, but it's most likely if you bring 20 females and 20 males, the possibility that 18 out of the 20 of the females will have osteoarthritis, and maybe 3 out of 20 in males will have osteoarthritis. So female, I'm sorry, it's just the way it is. So now, why female? So now, the reason it's because there's an hormone. The reason why it's common in female is because of the hormones that help them during menstrual flow. So this hormones goes up, goes down. So it's just they control their menstrual flows. So that is why. Now, you will notice that osteoarthritis is not usually common in reproductive age girls or women. It is when women are now becoming men. You know what I mean? So women becoming men. So what I mean is just that when menopause has, or when a woman is about to enter menopause, or they are in menopause, because of the drop in this hormone. So the hormone usually, apart from the menstrual flow, it also helps in blood flow in the joint. So when it drops, it sort of dysregulates those things too. It helps, like I said, it helps to sort of nourish the joint, increase the blood flow. So when it drops, it affects the structures of the joint too. So that's why they are prone to it. And then, so during menopause, these things can start coming up. I mean, they start noticing that, oh, my joint aches and everything. So that's one. So there are some other factors too, but like I said, I will just pinpoint the basic ones, that because I don't want too much of information at times. You might not be able to get it, accurately, because the aim of this video is just to, educate, because I feel sad at times when people come to hospital and because they don't know, they ask questions. But the other things that may causes osteoarthritis is sedentary lifestyle. So what do I mean by sedentary lifestyle? It's just a kind of lifestyle that work to house to what to work. So those kind of lifestyle are sort of sedentary. So if the lifestyle, and if you notice that, if you notice properly that osteoarthritis, like I said, is a disease of elderly, and because at that time our work efficiency is reduced at that particular time. So most time people just sleep at home, wake up, do the normal things. I mean, every time at home. So that kind of thing can also make somebody have osteoarthritis because of sedentary lifestyle. So they are not going, they are not being active the way they had before. So now the sedentary lifestyle will also make somebody to be what? Big, become obese, and then obesity. It's also a factor that can make somebody have osteoarthritis. And now the osteoarthritis in youths, like be it a male or female, at the earliest, I mean, at the reproductive stage, just look at the weight. Usually, they they might be obese. So because, and the reason is that when the obesity usually because of the increase in weight, especially of the upper part of the body, is the leg that will bear those weight. And then when you stand, when you try to walk, you feel like some discomfort in your in the knee area or in any part of your body. So obesity is also a factor. So that's why when you come to the hospital, they will say go and lose weight. And then when you lose weight, when you wash your weight, usually it's improved. So there are some other occupations too that can make somebody have this osteoarthritis. If you stand too long, if your job entails you to be standing longer time, you just stand, or like all those armies that they stand for long period of time. So police, even doctors too, I know some doctors that are also battling with osteoarthritis because of long standing hours. And then, so those are the risk factors. Apart from that, other risk factors are, if there's a family history, even though it is not but a family history of there's a family of osteoarthritis, so it's likely that the children too might, when they grow up, they might have it too. But that is like the percentage is not really, maybe 2% of people that have a family history of osteoarthritis will later develop, the children will later develop osteoarthritis. So just to recap, I told you about the risk factor of osteoarthritis. We talked about the age, very important. Age, usually it is common in elderly people. I mean, usually between 40 for female and maybe 50 for male. And the reason for 40 is that I've talked about the hormones that regulate menstrual flow. Usually it drops at that stage, and then you can see it. Then I talked about the sex, usually female are more to have it than male. I talked about the kind of lifestyle the individual is living, a sedentary life. The other part that I didn't talk about is if somebody has had injury in the knee before, knee area, maybe in the joints, an injury in the joints before. So it can also, later in life, it can also predispose that individual of having osteoarthritis in the future. Have anything you want to, any comments or any questions you want to ask, you can drop it. Don't forget to like the video and also share to people that might want this kind of information. So thank you. Bye.